Hi, my name is Dr. Piero Perucca, and I'm a researcher at the Melbourne Brain Centre at the Royal Melbourne Hospital. Today we'll be talking about a research project that we're carrying out at the Epilepsy program of the Royal Melbourne Hospital. The project is entitled An Investigation of Genetic Factors Predisposing to Valproate, or commonly known as Epilepsy-associated neural tube defects. So the first question I have is, what are neural tube defects? And neural tube defects are birth defects consisting in the failure of the neural tube to close completely during the early phases of fetus development, and this results in incomplete formation of the brain or the spine cord. Neural tube defects have an annual incidence of approximately 1 in 1,000 pregnancies. The two most common types of neural tube defects are anencephaly and spina bifida. Anencephaly consists in the complete or partial absence of the brain and the skull and is not compatible with life after birth. And spina bifida consists in the herniation of neural tissue through an incompletely formed spine cord. This is compatible with life after birth, but often there are neurological and medical complications which pose a risk for lifelong disabilities. So what is the association between neural tube defects and valproate? So studies over the past 30 years have highlighted that the use of valproate in pregnancy is associated with a 10 to 20-fold increased risk of neural tube defects compared to the general population. Valproate is a common medication for epilepsy and is also known as Epilim. And the easy way out would be just not to use Epilim at all. Unfortunately, this is not always possible, as this medication may be the only agent that is capable of stopping seizures in many women with epilepsy, particularly those who have an epilepsy syndrome called juvenile myoclonic epilepsy. And it also is very effective in other generalized epilepsy syndromes. The use of valproate also goes beyond epilepsy, and it's increasingly used in migraine as well in psychiatry. So it is really important that we identify predictors of valproate-associated neural tube defects. Now, there are multiple evidence suggesting that valproate is a risk factor for neural tube defects. Recent studies over the past few years have shown that this association has a dose-dependent relationship, meaning that higher doses of valproate taken in pregnancy are associated with a greater risk of neural tube defects. However, there is also evidence suggesting an underlying genetic predisposition. And this evidence comes from studies in animals in the lab, as well as in humans. In animals, studies have shown that different strain of mice may display different susceptibility to valproate-associated neural tube defects. And one study in mice has also shown that these genetic factors may be present on the chromosome 7. In humans, the greatest evidence suggesting an underlying genetic predisposition to such association is the fact that only a small proportion of women who take this medication in pregnancy will actually will go on having a pregnancy resulting in a neural tube defect. And this proportion is estimated to be around 1 to 2%, which means that the vast majority of women who are taking valproate in pregnancy end up having a healthy baby. So the rarity of the disorder itself, of the birth defect itself, is suggestive of a genetic, an underlying genetic predisposition. So reports, there are reports showing that women who take valproate or Epilim have had repeated pregnancies resulting in neural tube defects. Now, one of these women was switched to another medication, and she had then a healthy child. So there are multiple lines of evidence from animals as well as from humans, from people, suggesting that there is a genetic predisposition to valproate-associated neural tube defects. But despite all of this evidence, to date, these genetic factors have not been identified. And this is where this study comes in and holds the promise of addressing many of these questions. This study will be a large multi-center, actually this study is a large multi-center international collaboration, which I'm proud to say is led by Australia. Australia has been at the forefront of epilepsy research for many years, and genetic research in epilepsy in particular. And as a community, we understand that we cannot do things on our own, and that we need help from different people. And therefore, helping us in these projects are collaborators in Europe. We have collaborators in Sweden, Belgium, Italy, and the United Kingdom. We also have collaborators in the United States and in Canada. As my grandfather used to say, 2 heads are better than 1, and definitely 3 heads are better than 2. And we understand this. We cannot do this alone, and we need the help of many people, starting from the patients to many researchers. And who are we looking for? We're looking for 3 groups of people. Number 1, we hope to enroll women who had a pregnancy while taking valproate, resulting in a neural tube defect. And we would also invite to participate their husbands as well as their children. The second group of people we're interested in are women who had pregnancies while taking valproate and who had healthy babies. We're also interested in their husbands as well, and their children. And the third group will be women who were not taking any medication and had pregnancies resulting in neural tube defects. And again, we would be interested in their husbands and their children. Now, how we would be looking for these genetic factors? This can be done by providing a small blood sample or a saliva sample, where we would be analyzing the DNA. The equivalent usually is considered sort of a teaspoon of blood or saliva. So it's a small amount, but it's a huge contribution to the study. Here in Australia, we're carrying out the study as part of the Australian Pregnancy Register, which is the largest register for women who are taking anti-epileptic medications in their pregnancy, and has contributed enormously to the understanding of adverse effects and the treatment of different conditions in women who require medications for epilepsy during their pregnancy. And you can find below the link to the register, and as well as the people you can contact, you can get in touch with to participate in the study.